When our son was diagnosed with stage 4 cancer, we wanted to know everything science and experience has proven effective. What we found was a lot more than we were shown at the hospital. With so many highly educated, seasoned professionals operating outside the bounds of conventional medicine, it just didn't make sense to limit ourselves when the stakes were that high. This approach paid off, and now we're bringing the information to you. Wisdom from the top integrative and holistic cancer doctors and healers around the world, all in one place. Because you deserve true answers to cancer. It's time for a revolution against one-size-fits-all medicine, a revolution that takes us back around to the old ways of healing and forward to the new. That revolution starts right here. When it comes to reversing or preventing cancer, this is where you come for the best of the best. I'm Ryan Sternagel of the Stern Method, and this is the Anti-Cancer Revolution. Hey there, it's Ryan, and this episode is highlights from our Going Integrative Plus community calls, where real people get to ask the top holistic cancer doctors in the world anything they want, each and every week. Stick around at the end to find out how to be on these calls asking the questions yourself, but in the meantime, enjoy and take something you can use right now from the show.
But Dr. Anderson was my son's naturopathic oncologist when we were deep in the woods, and I've learned a lot from the guy. I took every far-flung question I could, scour on the most alternative websites, and he knew about whatever it was and had a great answer for everything. And that's not like every naturopathic oncologist.
Yeah, so I'm Paul Anderson. I'm a naturopathic physician from Seattle, Washington. And as Ryan said, we met because of Ryder's diagnosis and treatment, etc. And that was a long time ago now, right? My practice has always had two about equal sides. So half are people with cancer. And over the years, I've always included children and pediatric cancers in that, which is even in the adult oncology world on the other side, the allopathic side, they kind of divide that up. So it's a little bit unusual to have people doing both adults and children, but there's a few of us that do. And so that's one part that's unique. The other side of the practice are people with very complicated chronic illnesses that are not cancer. So everybody has something chronic, and there's a lot of crossover in those two communities. In my spare time, when I'm not, I teach doctors a lot, which is a good thing to do. I'm trying to just share the hard-won knowledge and give back. When I'm not doing that, I write this book here, Outside the Box Cancer Therapy. So Dr. Stengler and I were in medical school together, and we wrote that. I'm right now finishing a book that the Sternagels have contributed to as well. More so, Outside the Box is more about what you do for yourself with cancer, natural and integrative therapies. The next book is about optimizing how do you deal with the process of being diagnosed and not let that get ahead of you, because the mind game, as we like to call it, the mental emotional setup that you have or you have for your children and your family is huge, and it can affect you in big ways. So that's the next book coming out.
How does a naturopathic oncologist differ in what they offer from an integrative medical doctor?
In my practice, which is what I consider kind of on one end of the spectrum, I have done this a long time. My experience is what trained me in the world of oncology for the most, but now I had other training and all that stuff. But I mean, what I really know, I learned from my patients for a long time, a lot of patients. That led to kind of subspecializing in areas that other clinics didn't have the technology to do, or the ability, or just didn't want to mess with. Things like IV therapy, hyperbaric oxygen, some of the like hyperthermia type therapies, and a number of other things of that nature. And that's just what we sort of gravitated to over time, because it was always something we could provide people. So I worked with a lot of people in the spectrum of integrative and naturopathic oncology and did those things for their patients or my own. that sort of thing is not as universally as accepted as what a lot of people do in the middle of the spectrum, which is a lot more non-interventional. It's somewhere in the spectrum of, well, we'll see what the standard oncology people say, and then we'll modify what we do based on that. And that has a lot to do with the way that you wind up practicing, but it has less to do with whether you're a naturopathic oncologist versus an integrative MD than kind of where you're at on the spectrum. The other thing people, I think, is important to know is, and this is no negative or positive on either practice type, I have colleagues who work in clinics with standard oncologists, and they have more or less latitude in what they can do. So if you take, for example, colleagues of mine, a lot of my former students wind up working at certain cancer hospitals that integrate, say, naturopathic oncologists, which is great, but they're really under the rules of that hospital. So what they can do is way less than what they know. And it's the same if if you have an integrative oncology medical doctor, let's say you're a doctor of osteopathy or something, if they're in one of those systems, they kind of have to play by the rules of the system and work their things around the system.
Do you do IV vitamin C for patients? And if so, high dose, like 75 grams, or lower at around 25 grams? Or somewhere in the middle? Or how do you figure out dosing for vitamin C?
This is something that that I'm actually an internationally recognized expert in. So I'm going to tell you that most people with very strong opinions are just coming up at it from looking at it one way their whole career. You can have as many benefits with lower doses as you can with higher doses. It's how you use the tool. So if you're building a house and you have a finishing hammer, which is a small fine hammer for little nails, and you have a framing hammer which can take off an appendage if you miss, which is a very big hammer. They're made for different things, and to build the house you use both of them, usually, unless you don't do any finishing work, right? So more than which is better or worse, because we do everything and everything in between, is when is it best to do these things, okay? So in people that have good G6PD enzyme function, which is a safety thing, and decent kidney function, because the IV does have to be cleared through your kidneys, but let's say those are fine, your basic labs are good. Whether it's a child or an adult, in the beginning, we often do higher doses. Now, higher doses in children are going to be body weight adjusted. Obviously, you're not going to give them the same dose you give me. And to a degree in adults, a smaller adult, larger adult, it's going to take more to do the same job. So what we usually do is an estimation in their blood of how much vitamin C is staying in their system after the IV. High dose in cancer, though, for most adult-sized people tends to be between 50 and 100 grams. In order to get to those blood levels. Now, the blood levels are not magic. They're just a measuring tool to say, for my body, it requires this much vitamin C to get there. In the beginning, though, often if kidney functions and labs look good, we start with higher doses, because here's the real cool thing about vitamin C, and this is something that gets overlooked a lot. With a high dose, if that's appropriate for you, so let's say for me it's probably 75 to 100 grams to get to that level. You can't tell from here, but I'm not a small person, so I take a lot of vitamin C. For me, if I get up to that level, for the hours after the IV, and the same would be with a little child at the same adjusted dose, I have this benefit of a super high plasma level of vitamin C, which provides some oxidative benefit. It triggers a lot of downstream things that harm cancer cells and get the immune system involved in the cancer. But after you leave that window, you still have a lot of vitamin C in your system, because it takes a long time to get rid of it. So for about 24 hours after, you get the benefit of what we would consider a low dose vitamin C treatment, which goes to all your normal cells, especially your immune cells, but also just your rest of your normal body. And it supports the antioxidant functions inside of your normal cells. So vitamin C is one of the few treatments that is very disturbing to cancer cells and yet very supportive to normal cells. And one of the big things in cancer is if we can not have your normal part of your body, the healthy cells, be converted to cancer and not have them become damaged during the treatment process, that's a win because you got more time to deal with the cells that have cancer. So high dose kind of does both of those things. Low dose is actually reasonably well studied nowadays. And lower doses would be, let's say for someone my size, it might be 15 or 20 grams or 10 or 5 grams. The studies are generally done around 10 to 15 grams for low dose, lower in some cases. But with low dose, with real frail people, end of life people, et cetera, there's actually extreme improvements in quality of life and a lot of other measurements of function, even if you're very, very frail. So it's, let's say you came in and your kidneys weren't working well, or maybe you had that enzyme defect or something, we could still do low dose vitamin C with some supportive things, and you would still get benefit.
Another one from Karen. Does he use RGCC testing for the amount of circulating tumor cells, or IV gene test for someone wanting to know if cancer is brewing but not yet, there has not yet been a tumor found?
The circulating tumor cell tests are getting better and better. I can tell you that even now, about 10 years ago, when we were doing the study for NIH, we used some of the earlier versions, RGCC and Cell Search and some of the other circulating tumor cell tests, and they were, quite frankly, horrible because the technology it's hard to find circulating tumor cells and measure them and all that stuff. What you have to know with lab tests is that, I mean, unless the lab doesn't change, the same name of a test you have today might be very different in 10 years because the technology changes. And so what we've tried to do with circulating tumor cells, which are incredibly useful, is look for the technologies that are the best validated and the most cutting edge. Biocept is one that we use a lot, but they only have certain cancers that they do. MainTrack is similar to RGCC. They're both European countries, and it's MAINTRAK, I think, from Germany. We've used them a lot. IV gene we also use, as you sort of alluded to, for either brewing cancers or is the genomic environment more pro-cancer or not for particular types of tumors. IV gene can be very good for that more predicting thing. And I guess what I've seen, and again, that this is either a benefit or not of coming from a time when we didn't have any of these tests, tests are a great signpost, and they're one piece of a data point that's really important. So if you get a reliable circulating tumor cell test and it's staying stable or going down over time, not just one test, but over time, that's a good sign. You can really rely on that sort of data. If you see it starting to crawl up and not just one little bump, but every time it's higher, there's something inside going on that you got to get after. But I think the place where they really shine is if you're in remission or no evidence of disease and you're just monitoring to make sure you're staying there, that and other tests are gold for that. The other thing is if you're doing a big treatment, you got big disease, and you want to see if it's trending down, you're winning, so to speak, they're great there too. So those are the places. As far as different testing platforms and companies, I mentioned the ones that we use, and the next step of that is what as long as your practitioner's done the due diligence to kind of look into the test platform and the reproducibility and stuff. Most of them have merit in different ways, and right now they're getting a little better at being more of the same, like giving same information. But when they first came out, they were all looking at completely different things. So you do have to be careful with that.
Do you have any pearls on an earlier stage cancer versus something late stage?
Yeah, I mean, early versus late stage. There's sort of a couple of things, but the first thing is practicality. If you are at a aggressive later stage or an aggressive type cancer that's on its way up and nothing's slowing it down, or you just found out you have it, what we normally think of with that and what most patients resonate with is we don't have time to mess around here. We need to kind of throw everything we can at it. so you're accessing things like the whole dietary end of your life, the getting rid of toxic things, helping the body to clear junk out that we all collect. All these things trigger cancer. Then you're looking at things that could possibly also be going on, like gut problems and infectious problems, and maybe hormone issues, all these things. And you don't, at least the way I look at it, dealing with people with really aggressive, fast or late stage cancers, you don't have time to say, well, we're just going to work on this one little thing for a while and then do another little thing. Your body's not at that stage. Now, if you, on contrast, have an earlier stage cancer, and it's one, let's take I'll quote unquote easy, I'll just say, as compared to like end stage, pancreatic cancer, you take a stage 1 breast cancer or early stage prostate cancer, something like that, where people tend to live a fairly long time. The problem mentally that you can get into is, yes, it's not end stage pancreatic cancer, so great, but it needs just as many things taken care of around the whole of who you are and what's healthy, what's not. It's just that you don't feel the urgency to do all of that. So with those folks, we're more apt to focus on all the non-cancer stuff and like detoxifying them, removing the toxins from their environment. If they have lingering, hidden infections, those are real big cancer triggers. Gut problems are a huge deal. People not being in great physical shape is a huge deal. All sorts of things all around the mental, emotional side, all that. And those will keep you from getting cancer back, balancing hormones, all of those things. If they have an active cancer early on, we still have them working on those things, but we might then start things. And here's where the answer is multiple choice. For some people, for example, we might do interventions aimed at the cancer that would be some high dose, very concentrated mushroom extracts or mixtures of mushroom extracts, which are very good. We might do some IV things. We obviously would change or look at their diet, change it if need be, and that sort of stuff, which is very important. Or, they might seem to do better with other types of therapies. So or they've done mushrooms and they want to try something else. We might do metabolically oriented things. So, exogenous ketones and a dietary shift and all this stuff. For other people, we've had people where they really just resonated with the idea that they wanted to do, we call it an induction to kind of get the body's attention. They wanted to do a raw food, like vegan approach to getting their body's attention. Great. We walk them through that. And then usually with diet, usually start out a little more extreme to kind of get, like I say, get the metabolic attention of the body, to help them start to detox. And then you kind of, modulate to something that's livable for the long term. So early on, you've got a lot more options there. A stage 4 patient that's just blown through all the stop signs and nothing's working, you're going to focus mostly on, let's get this cancer's attention and get it to slow down, and then we'll figure out what else got you here and take care of it. So yeah, it's I always try and tell people, if you can't prevent cancer, which is what we all want to do, but once you have cancer, first primary prevention's gone. Initial treatment is crucial, but recovering from initial treatment is also crucial. And then secondary prevention, keep yourself from having it. The other thing that is, and I think we're the first book to publish this. It's in lots of studies, but nobody wanted to put it in writing beyond the studies. Chemotherapy and radiation, which sometimes you need, sometimes you don't. But chemotherapy and radiation, one of the downsides of them, even if they help you reduce your tumor mass, they greatly increase your chance for secondary cancers, either of the same kind or a totally new type of cancer. And that's because they embolden your cancer stem cells. So our bigger picture of looking at people is whether the chemo helped them or not, or whether the radiation was good or not, or whatever. Sometimes it's great and gets them, to a place we can treat them great. Sometimes it doesn't. Regardless of what the outcome was there, we have to repair the person and make sure that this cancer stem cells stay really, really quiet and, go to sleep. So there's a lot of factors, and yeah, your timing is different with a low stage or an early cancer than a later cancer, but ultimately you've got to get to all those pieces, or you're you're just poking at one little part of a big giant problem.
What diet works the best most of the time for cancer elimination?
I wish there was one answer to that. Um,
Bad questions.
yeah. So here's the thing, though. I'll try and answer as it's related to my last answer, so I can shorten it up a little bit. Uh, After seeing a lot of people do a lot of different diets over about 3 decades now, and everyone having more or less promise with cancer or whatever, but seeming to be a great idea. What I can say is that if you step back from what was in the diet for just a moment, beyond, and these are crucial things, but beyond the basics, which are so crucial, they have to be stated, like you can't eat junk of any kind in any diet, right? Um, so whether you're doing, say, a keto approach or a raw food approach, if it's processed and full of chemicals and pesticides and herbicides, it's not going to help you. It doesn't matter what kind of diet it is at that point. You're feeding yourself a poisonous diet. So first it has to be clean. Next it has to be balanced, right? All that business. But the most important thing I've seen for the beginning part, and then you can sort of morph it after that, and you totally can do it where if you pick one or the other perspective, you can see often fairly rapidly an effect on the cancer itself. And by that, I mean within 1, 2, 3 months, usually. The underlying thing of what I've seen work the most with people has been literally metabolically having the diet get the attention of the entire body, all the cells, and say, whoa, something has changed here. We have to focus on, and we have to clean the system up. So there's a couple of tenets that I think now, that, and one of them I'll say works on either end of the spectrum. Intermittent fasting, now even in human studies, is being shown, even if you get to like 13 hours, which almost all humans can do. Some people think they can't, but you can get to 13 hours usually of intermittent fasting. That in one breast cancer study with they didn't change the person's diet. They just took a group and had them intermittent fast for 13 hours or not. The diet same. They had a third less recurrence of breast cancer in the group that intermittent fasted just for 13 hours, because it turns on the autophagy and is cell cleaning, and it does many other metabolic things. So that's something you can do on both ends, and that's what we have people do regardless of which end they choose when they come in. But then we have developed this idea of, and I have them in little triangles. I like triangles because they're, I don't know, graphically pleasing. But we say, look, with your lifestyle, the way that you eat, etc., we have to change things. We have to get your body's attention, unless you've already done it. Intermittent fasting, we're going to do no matter what. We're going to clean the junk out of your diet, so food dyes and pesticides and all that business, that's got to go. Good clean sources of stuff to the degree that you can get them. Then we say, to get your body's attention, we've got end of the spectrum over here that is plant-based, and it is a lot of polyphenols and fiber and a lot of vegetable matter with a lot of dense nutrients. There's not a lot of carbohydrate, simple carbs in it. And it tends to start out as a raw food diet, etc. That actually does get your body's attention rather quickly, unless you're already eating that way. The other end of the spectrum, which we will use, and with some cancers we might tell people, let's start here and then figure it out later, is actually starting with a ketogenic approach, which would be dietary plus exogenous ketones manipulated or added. Both do almost the same thing. They suddenly take your whole body metabolism and shift it remarkably. And what's really interesting is they both shift it kind of in the same direction. Now, there's something about having extra ketones around with certain types of cancers that's probably a good idea, but that's sort of a different thing. What we tend to do, though, is start there not because to be extreme, but to get your metabolism's attention, and then morph towards whatever works for you long term, because what you can do long term sometimes isn't the same as what you do short term. So we might do induction with people where they're doing some intermittent fasting. We've had some people say, could I do a 3-day fast to start? And if it's medically feasible, yes, we can do that. It just gets your body's attention. And so it tends to be on either the keto side or what I call the raw food induction side, and then that turns to what you could, most people have heard of a Mediterranean diet. It's a modified Mediterranean diet that's very high plant-based with real clean protein and fat sources, but the grains are removed from it. Essentially, it's neither one has grains in them. Sorry, grains. So, and there's things you can do with that later, but the bottom line is that my experience would say there's not a best diet. Now, here's the thing: I have seen people go into remission with some nasty cancers like advanced pancreatic cancer doing both of those things. The most important part is that it got their attention of the body. What keeps the remission going, of course, is not having the junk in there, and they're doing intermittent fasting, all that. But what keeps the remission going beyond that dietarily then is, what do you do with what they're eating from there forward? And then, what other treatments are you doing to help keep their body from it? I have had people, one of the longest, this was someone who was a doctor's spouse, and they had read about doing a keto. This is a long time, way before keto was famous or anything like that. This is way before anyone was writing about it. And they came to me and they had stage 3 or 4 breast cancer, and at that point they had done nothing but natural treatments, and they'd been alive after diagnosis for 12 years at that point, and their main tool was being keto, and they had nutrients they were taking and stuff, and they just wanted me to monitor them more than anything. So I got to monitor this person in their case, and they survived with pretty nasty cancer for, it was 15 plus years, with their diet being the major change. The thing that happens to people over time is, if you're doing a ketogenic diet, if you're not careful after your body adapts to the macros, how much protein and fat and all that business, what happened with them was your body says, well, I'm not getting any carbohydrates from the carbohydrate world for the most part. I'm going to take the protein that we're doing, and there's certain types of aminos and proteins that just converts to sugar. And that was happening with her, and she wouldn't change her diet, and she eventually passed away. But like 15 years with only a dietary intervention is pretty impressive. I've seen that with pancreatic cancer. But I've also seen people make the other shift, and what they've often done is a fast, and then a whole foods raw type diet, just to get the attention of the body, and then morph it into modified veg or whatever works for them. And I've seen the same thing happen. So I'm a proponent of multiple diets based on what type the person. Well, number one, what can you do, right? Because there's some people that sometimes biologically people cannot do a keto type diet, or they just can't do it for other reasons. There's some people that just can't tolerate a raw food induction diet or whatever, but there's options. So most of it, and if you look at what's in common, there's some intermittent fasting, there's removing the junk, the literal chemical junk from the foods you're eating, and they're just eliminating a lot of calorie sources that do us no good at all. And I think those maybe make more change than anything.
What blood work do you track monthly?
Again, depends a little bit on folks, but beyond the standard blood count and the chemistry, look at your electrolytes and your kidneys, the things that show hints of either inflammatory or hypoxic processes in your body, which are actually part of a larger chemistry profile. It used to be part of the regular chemistry profile, but they took them out and you have to add them back in. So lactate dehydrogenase is LDH is the thing that they order on the lab. Alkaline phosphatase, GGT or GGTP, things like that. What they show, and here's generally what I have to warn people about. you get one lab with those on it, and they can be up or down for other reasons. You're getting over a cold, or you're, something else going on in your life. You just started exercising again or something. But if you're getting them every 1 or 2 months, which is kind of average with a lot of folks, and these are not terribly expensive. They're done automatically. It's not like getting like a circulating tumor cell that costs a big bunch of money. These are just kind of regular lab tests. You can plot them over time. And if you look at these things that look at hypoxia or inflammation, and you could add on things like the C-reactive protein and other, there's basic ones there. If over time they're kind of staying level and they're not out of range or whatever, what it's saying is that the biology inside the person is the demands are being met well, and the antioxidant pro-oxidant balance is meeting, and there's not processes that are hypoxic, not enough oxygen, which is a cancer trigger, going on that you can't see. If they were high and you do treatment, whatever the intervention is, and they start to trend down, that's also what we like to see. And all these things have normal. You don't want them to go to zero, right? So you want them kind of normal-ish. If you see something over time where you're doing things, it's working, person's feeling pretty good, but every time you do these things, they keep trending up. It's sort of like a circulating tumor cell test where you see it trend up over time. It's not the end all be all, and it's not diagnostic, but what it tells you is this is a body that is fighting, and it's losing some battle somewhere that would make cancer more of an opportunity in that body. So if we start to see that, even if the person's feeling good, we might dial back and say, here, I'll give you the top couple I've had with people when we see this. First one is, all that diet stuff that we were doing that helped me in the beginning, I stopped doing all of that. And they're back to eating, just junk or whatever. Or I've gone to the super high sugar diet or whatever they're doing. So that's one. So you have to actually ask basic questions. Another one, though, can be, you have actually done so well and their cancer's, let's say, in remission, and they've been eating really well, and you're giving them nutrients and all this stuff, right? One of the benefits of that, but you have to watch out for it, is if they're a super toxic person, they'll get to a place where the cancer isn't such a problem. Their body says, gee, I got all this extra stuff here to help me metabolize. I'm going to start to dump toxins out. We've had people, and I don't know whether it's just our practice or where we are or whatever, but over the years, more women and children than male cancer patients see our practice. A lot of the men who would come in tended to have very toxic professions. They were painters, roofers, plumbers, welders, whatever. So, and it's not, that is what it is. But if you think about it, we all soak in toxins, but if your job gives you toxins every day and then you get cancer, when the cancer kind of settles down, your body will say, gee, we've been waiting a long time to get rid of all this stuff. So a lot of times we see those things trend up, but the person seems to be doing okay. We'll actually recheck. You can do urine testing for metabolites of a lot of chemicals, mold toxins. You can do other tests for metals and things. So they may just need to detox at that point. So it may be they didn't change their diet back to being a crappy diet, but they are now detoxing. You got to deal with that, right? So those are, and the nice thing is they shift up things like, say, LDH and alkaline phosphatase and GGT and all these real basic sort of labs, CRP, et cetera. They'll start to trend up before anything else will go wrong. And it gives you time to sit back and say, what's likely doing it? Do we need to check into your toxic kind of milieu? The other one that we have, and this has tended to be people, well, almost any, but especially our early stage cancer where they're in remission, they'll have either because the cancer treatment they got being immune suppressive or just because of life, they'll have a lot of infections they've kind of collected that don't give them a lot of symptoms. And when those infections start to be battled with by the immune system, like, your CRP and LDH will go up and some other stuff, we might step back and say, do you have chronic Epstein-Barr? Or how's your gut flora? Or that's another time And what's cool about it is those things are things you can do stuff about. And those labs allow you to see shifts before they get so bad that then the cancer the door opens and it's the cancer coming back. So those are my favorite basic ones, and certain cancers, there's specific ones.
Best ways to kill cancer stem cells long term.
That's the $1,000,000,000 question. um, so there's a couple things with cancer stem cells that are, the more we learn about them, the more it makes total sense if you watch people with cancer over time. So the whole thing about all of the publications that say, gee, chemo or radiation has this much chance of, suppressing the tumor or knocking down the size of the tumor, we kind of know that. But we also know that if you do one or both of those therapies, you have a higher propensity for other tumors or that tumor to come back later. And it turns out that it's not the tumor itself, because what we call the daughter cells, the big tumor you see is mostly daughter cells. The chemo radiation beats those up. Great. Okay, there's a lot of natural things that beat those up. The problem is that the stem cells are way smarter than the daughter cells that make the tumor. And so they literally will often either figuratively or literally retreat back into your normal tissue and wait. And they'll wait. And they are emboldened a bit by some of these other therapies that go on. But their whole thing is, you think about it, they're about survival. And so if they see all of the main tumor tissue getting beat up and all of that, they're going to say, this is not the place to be. We're going to go over here. We're not largely affected by radiation chemo anyway. We're going to hang out here. Probably most humans have cancer stem cells. Okay. The biggest issue with cancer stem cells is keeping them asleep forever with no reason to wake up and do anything. So I have friends and colleagues and patients who had deadly cancers 20, 30 years ago that are sitting there in their body and they're completely asleep. They have no sign of the cancer now except that it's there, right? The cancer in the stem cells have just gone to sleep because they have made changes that engender that. The negative that you're trying to get apart from with cancer stem cells is they will sit there, and it's not them that you're worried about. They will take your normal cells that are supposed to help you, and if they get agitated, the cancer stem cells, they will literally recruit your normal cells to come over to the dark side and become cancer cells and start the process again. So it's the recruitment that you really have to worry about. So one of the reasons that when I would talk to patients on the front end, wherever they were in the whole spectrum, and say, we're actually more interested in keeping your healthy cells healthy than the cancer cells themselves. That we got stuff to do with the cancer cells, but you got to know that keeping the rest of you, which doesn't have cancer, healthy is the best way to keep cancer away long term. And that goes to all those other things. Now, what triggers cancer stem cells to wake up? Inflammation of any kind. So things, for the most part, things like a very pro-inflammatory system. So that could be you're not exercising enough. It could be dietary. It could be toxins. It could be infections. It could be any of the things that bother humans normally. Well, it's just if you have cancer stem cells, you don't need that poking on them, trying to wake them up. Bottom line is, the healthier that the rest of you exists, the lower your toxicity level. Something we alluded to, but diet, of course, is huge for a zillion reasons. You bring in toxins through your diet. You can bring in less if you eat better. But the other thing is, between diet and then your body's metabolism, meaning moving your body and stuff, if you get those working in the same direction, meaning you're getting your muscles working every day, and your diet is not full of junk and it's not high sugar and all those things that we know aren't good for us, you actually have more metabolic triggers that are anti-cancer. Same with intermittent fasting and other stuff like that. So intermittent fasting, periodic longer fasts, etc., those do slow cancer stem cells down. The normal things that we do with people during cancer therapy to clean up their diet and detox, those help. And then if you have things that are in you that are in a larger amount, like, you were a painter or welder or something, or you were exposed to a lot of junk, or maybe you're just sensitive to that stuff, or you have mold exposure and your body's harboring a lot of mold toxins, you just got to deal with that stuff. Otherwise, the cancer stem cells are just going to say, this is a great soil to grow in.
NAD, is NAD plus safe with cancer, a family history of cancer, and endometriosis?
Ooh,
Question.
good question. Um, so here's the bottom line with NAD therapy. Uh, Big picture. So NAD, so nicotinamide vitamin B3 is great. It goes in, we get it from food and all that. Your body usually takes two B3s and hooks them together in this more complex molecule called NAD, nicotinamide adenine dinucleotide. And it's a cofactor for a ton of stuff, like in your brain, in your liver, in your muscles, pretty much everywhere. So without NAD, you would die immediately. That's how important it is. It also, one of its big claims to fame is it's part of mitochondria making energy, which is, again, if you don't have that, you're not with us anymore. So there's sort of it's a little bit like vitamin C. There's two levels with NAD that are relative to cancer. If you do have cancer, you have to be cautious with NAD in higher doses, because and this is one area that I speak about specifically for doctors, because NAD therapy is big with addiction medicine and brain stuff and energy and all that stuff. So I'll do the cancer NAD connection. And right now, the people who look like the smartest minds in the world in biochemistry and tumor biology and stuff, and who know about NAD and write about it, basically say the trouble with NAD at higher doses, we're not talking about low doses, but at higher doses with cancer is NAD is one of the few things, so it has different states. It's got NADH and NAD, and it kind of goes back and forth. Some cancers favor one direction pushing that process, and some cancers favor the other direction. So if I give you something to either increase your natural NAD or give you NAD in an IV or something, and I push the levels really high, and you happen to have a cancer process that likes, so the cancer is going to benefit from the NAD pushing over the other way, that's not a great thing for you, okay? And the ability to test what way your cancer is going in the NAD, NADH, kind of balance is not, it's not reliable. You can't say these people need it and these people don't need it. The other thing is that balance can be different next week for you. So here's the current recommendations. History of cancer, if you're taking care of other things to be healthy, probably you have a lot of tolerance for NAD therapies. If you have an active cancer, we're very judicious about NAD use, meaning I wouldn't give you like a high dose NAD IV like you would give for say severe energy problems or an addiction medicine or neurology, where they're getting 700 to 2,000 milligrams of NAD plus in an IV. You'd never give a cancer patient that much. If you're giving 50, 100, 150 periodically to support your overall NAD function, then you're sort of at your physiologic levels. You're not doing it every day to the person. The one thing I would usually caution people with is, and it costs so much, most people can't afford it anyway to get themselves in trouble, but nicotinamide riboside is an oral version of a precursor that raises your own NAD naturally. So we use that a lot with people because they can't get IVs or whatever. If you're doing that as a supplement to your own natural, like your B vitamin status and all that, and you're doing 100 or 200 milligrams a day, that's not going to push your NAD levels so high that that's going to be an issue. But we have had people for they're athletes or they just feel better on super high doses of NAD, they'll be on 600, 1,000 milligrams of that stuff every day. That's probably enough to get you into some kind of trouble. And it's not that it's reliably a cancer trigger, it's just that it can be. And it's like that's playing with fire because you don't know when it can be and when it's not.
The book, Outside the Box Cancer Therapies, if you don't already have it, you should. Very, very helpful. Practical is what I like. You can actually take stuff out of the book and use it in exact these dosages and everything, which is pretty rare for cancer books.
That was our goal. And there's a lot of references. If your doctor doesn't believe there's any science, we left a lot of references in there.
Like half the the page volume of the book is references.
References, yeah.
I love it. And your clinic is in Seattle, Washington.
It's Advanced Medical Therapies on Facebook. Just Advanced Medical Therapies, you'll find it. AdvancedMedicalTherapies.com. That's we should keep it simple. If you're interested in integrative oncology, my former student of long ago and a board-certified naturopathic oncologist, Dr. Colvard, and I work together, and Dr. Colvard does the patient interaction. She's got just tons of experience from all around, and we talk. So if you want that, we can connect you up with Dr. Colvard.
And again, this episode was highlights from one of our Going Integrative Plus Q&A calls, where we get a top holistic cancer doctor on a call once a week, and our members get to ask whatever it is they're currently trying to figure out. If you would like to hear the rest of the 2-hour call, along with over 100 other calls we've done, along with the recordings, notes, and slides from our entire first and second Anti-Cancer Revolution online conference events, and most importantly, the ability to ask the doctors and healers featured on our events and community calls anything you want yourself directly. That's what you get with Going Integrative Plus. This is the resource and community my wife and I would have given anything for when we were going through cancer with our son. Each and every week, we get one of the top holistic and integrative cancer doctors on a call, and you get to ask them anything you want yourself. Listening to this podcast for your health is amazing, but getting to be the one asking the questions yourself about whatever you're currently trying to figure out dramatically shortcuts the learning curve and helps you make more right decisions faster and avoid the wrong ones. Again, you also get every past call we've ever done, which is hundreds of hours of content that's all transcribed, timestamped, and searchable, so you can see what all of our experts have said about any particular topic, which is a very nice antidote to how hard it's become to find good natural health information pertaining to cancer online these days. Huge discounts on all of our favorite supplements and devices, and maybe most importantly, a great community of people who are all on the same page with holistic healing. It is the absolute most valuable thing for someone serious about either preventing or reversing cancer we could imagine, which is why we made it. You can check it all out and become a part of it at goingintegrativeplus.com if you feel like this would be a helpful thing for you. And always remember, if you are going through cancer or anything else you'd rather not be, just keep going. God bless and Godspeed, and we'll see you on the next one.